Governor Charlie Baker is considering a bill that would provide additional funding and support to fight the opioid crisis in Massachusetts. Some of the provisions include expanding access to NARCAN and requiring that insurance companies pay for alternative treatments for pain management. Carolee McGrath sat down with Senator Eric Lesser from Longmeadow to learn more.
So basically this is part two of a pretty comprehensive opioid reduction bill that was passed about 2 years ago. So the idea was that while we've seen some incremental gains and we've seen some progress in the fight against the opioid epidemic, there's a lot more we need to do, and this is another step in that direction. One of the biggest items we did is now allowing over-the-counter access for NARCAN. We saw that actually one of the most effective ways getting the death rate down from those overdoses is expanding access to NARCAN. So we want to make that even easier by having a standing over-the-counter order at pharmacies in Massachusetts.
So parents could go in and if they needed it.
You know, data recently came out that shows that Massachusetts actually saw a slight dip in the overall opioid overdose death rate. Now, I want to be cautious about being optimistic about that or reading too much into it, because what they said was basically the entire reason for the drop in that death rate was because of the use of NARCAN. So NARCAN is saving lives, it's preventing deaths from opioid overdoses, but it is by nowhere close to the only thing we need to be doing. We need to be preventing the addiction from happening in the first place, and we need to make sure that people who do fall under that spell of addiction, that they receive the treatment and the support they need to turn their life around.
And certainly when NARCAN was first introduced, a lot of people were nervous about it, that it would be encouraging or enabling somebody to continue that habit and not seek treatment as well. But that's not what you're seeing.
Yeah, I mean, I don't think that anyone would be using NARCAN as a crutch. I mean, I think we were faced with an absolute emergency in this state. We were having an average of 4 people dying a day from opioid overdose. We had a moral obligation to do everything we could to stop the deaths as quickly as possible, and NARCAN was the most effective way to do that. We need to continue, I believe, to get NARCAN into the hands of our police, our firefighters. I sponsor provisions that have been adopted by our governor and by our legislature to bulk purchase NARCAN to bring the costs down, pass those savings back on to our cities and towns. But we really need to go much further than that, and as you said, we need to prevent the addiction in the first place. That means, I think, cracking down on the pharmaceutical companies that have made quite a lot of money peddling these drugs in our communities. It means increasing education for doctors and for the medical community. It includes alternatives to pain treatment. The days of being given a prescription for 100 Vicodin because of a leg injury, I think, need to be rethought.
Let's talk about how the insurance companies would pay for that. What would be the alternative for somebody who just came out of surgery?
Yeah, well, I'll do it because this can get very complicated very fast for people. So we'll do it through a single person's experience, right? If you're a patient and you go into a hospital, you go into an emergency room, you go see a medical provider, and you have a pain in your back. In the old days, and actually still, for the most part, it's still too common, the insurance would reimburse at 90%, 95% for a highly addictive prescription painkiller. If your doctor or your medical provider said, well, why don't you try acupuncture? Why don't you try physical therapy? Why don't you try this alternative method? Often there was no insurance reimbursement at all. So what we've seen is an entire sort of financial and structural system that was steering people towards these opioids. What we need to do is broaden out pain management in our society. We need to improve the insurance coverage for things like acupuncture. I'll tell you, I worked on a bill about a year ago, started on a bill to provide insurance coverage, require insurance coverage for acupuncture. At first this was sort of laughed at as some sort of, pie in the sky thing. But then when people dove into it and they saw, wait a second, this is actually an anti-opioid bill as well, because in my mind, if it allows people to have an alternative form of pain management that steers them away from the opioids, that's going to help get those off the street, get those out of circulation, and give people safe alternatives. And it is worth pointing out, there are a lot of people that use these painkillers for important needs, whether they have cancer, whether they have chronic conditions. When it's managed and it's supervised and abuse is limited, there are appropriate uses for those medicines, but we need to give people who have that risk of addiction, who know that they want to avoid those types of medicines, the option to seek alternative treatment.
And talk a little bit about Big Pharma, though. I know within this bill, you talked about holding them responsible. Obviously, there are so many cities that have now filed lawsuits against these companies. How would this bill assist in that?
So, it's admittedly modest. I think we need to do a lot more, and I've been pushing for us to do quite a lot more on this. Our Attorney General, Maura Healey, is actually the only Attorney General in the whole country who has now taken on personal liability for some of the executives that have peddled these drugs. I included a provision in this bill, which the Senate voted on last week, to take a look at the liability laws we have on the books and the consumer protection laws we have on the books to try to see how we can hold these pharmaceutical companies, and in particular executives who knew they were peddling dangerous drugs, responsible. I personally think it's very unfair, and I think a lot of people in our communities think it's very unfair that these pharma companies, knowing how addictive these drugs were, knowing the damage that they were going to have on people and on their families, went out, sold these drugs, made billions of dollars, and now the taxpayers in our community, taxpayers in our state are being asked to foot the bill for an unprecedented epidemic that has killed thousands of people and has disrupted millions of lives. That's not fair. We need to take a look at the causes of this crisis and how we can make families and communities whole by making some of the people who were responsible for peddling these drugs in the first place step up and pay their fair share to do the best that they can to make this right. It's never going to be fully fixed, and the families that have lost folks will never be fully repaired, but we have billions of dollars of issues here in terms of adequately funding rehabilitation, adequately funding treatment facilities, getting more recovery coaches out there. We need the pharmaceutical companies that help peddle these products and made this crisis what it is actually step up and start paying.
Let's talk a little bit about the recovery coaches. So this will call for standards for professional recovery coaches. So what would that entail? Yeah,
so what we want to do here is really kind of professionalize and really encourage more recovery coaches, in particular in Western Mass emergency rooms. For people who don't know what these are, I'll just quickly explain. The idea is there's a constellation of people that help someone who is recovering from an opioid crisis. You have doctors, social workers, caseworkers, nurses, but often what the research shows and what I think kind of common sense shows is sometimes the most effective way to connect with someone who's struggling is to have them talk to someone who's been in that similar experience before. A lot of this has tied to research done around post-traumatic stress disorder for veterans. A well-trained social worker or a psychologist could work with a veteran for years and do their best, but unless they've maybe been in the same experience and can have a common bond, it's not going to be as effective. So recovery coaches are really peers, people who have gone through their own recovery process, who have come out the other end, and really know what it feels like and can connect on a more human level with the patient. There was a program around recovery coaches that was actually very popular in Eastern Mass. Mass General Hospital in Boston had one. We had a proposal, I had a budget item to try to bring those recovery coaches to Western Mass hospitals. It was a big fight. We had to really fight to get our share here in Western Mass, but we did get those recovery coach programs set up in Western Mass. Now we're taking it a step further in this legislation, which was actually originally proposed by the governor, which is to kind of professionalize and bring those recovery coaches into the system of healthcare so that we know there are standards, we know that there are performance metrics, and we can kind of professionalize this service a little bit.
And also when you're talking about people who work in addiction treatment, the numbers of workers, projected out to 2025, we're not going to have enough is what the numbers are showing. So I know part of this bill has a loan repayment for folks who are interested in getting into this field.
Yeah, very important. So, our human service workers, God bless them, they're paid very, very low wages in very, very hard conditions. And these are people really on the front lines of treating our opioid crisis, of helping people who are suffering from substance abuse. Most of these jobs require, at a minimum, a bachelor's degree, but often require much higher levels of education as well. And so people go into these fairly low-paying fields with high levels of debt, and that's not fair. So the idea is we're facing a shortage, as you mentioned, of these healthcare workers. So what we want to do is we want to put a program in place that if you go into a human service field, if you're out on the front lines helping people recover from their addiction, going into communities that are struggling, really giving of yourself to help others and help our community, we want the state to be there to have your back to help pay some of those loans you took on, to get the training to make that work possible. So that's the idea behind that bill. We're fingers crossed that we can get it across the finish line and get it to the governor's desk, but you're right. We're facing a critical shortage of healthcare workers, in particular mental health care providers in the substance abuse realm. We need to have a really focused strategy to get those numbers up.